إذا تقدم المتحدث الأخير.
Last speaker for this session is Dr. Muna. عفوا الدكتورة رانيا زيني. Dr. Rania Ziani is Assistant Professor of Medical Education, Faculty of Medicine, Al University. She has multiple roles in MBBS program at Al University as a manager and assessment unit coordinator. Dr. Rania has been the Vice Dean of E-Learning and Distant Education and the founder of the Department of Medical Education at Al University. She contributed to the efforts of transform of the Al University MBBS program to develop a unique integrated MBBS curriculum with strategic alliance with Medical School of University of College of London. She has interest in curriculum development and evaluation, quality assurance, and e-learning and assessment.
Thank you.
So the floor for you, Dr.
Thank you, Chairman, for this opportunity. Thank you for the Scientific Committee and for the Saudi Society of Medical Education Board and the President. Today we talk about the trainees' perceptions of online education and the directions for medical education in the future. So to highlight this, I have just to emphasize the impact of COVID-19 on medical education, and then I have to study the perceptions or review the student perception of this challenge of online education, and then to set the platform of what is the next step regarding where we move as a medical school. Just to remind you that the COVID-19 actually disrupted the whole educational process in disciplinary education and higher education and medical education as well. All the face-to-face activity has been suspended, and sometimes after the first phase of the COVID-19, the pandemic, there was a blended learning. The mood of learning, the mood of teaching has been changed to overcome these challenges. And as all of you know that the online and technology-assisted learning was dominating the practice with the presence of the no physical or the physical distance. So online lectures, tutorial, webinars, and courses replace all the face-to-face traditional teachings. Medical training and clinical placement has been suspended for most of the time and then has been minimized to major extent. Virtual clinical experience and clinical skills training virtually was actually introduced to bridge the gap in the training. Many clinical simulations platform has been introduced and utilized, and the assessment has been really changed. Assessment mood, assessment time, a lot of things has been changed regarding to the assessment. And as we all of us know that many studies have reflecting and study emphasizing how the student perceive this. So most of the study focus on 5 aspects: student perception, student acceptance, and the student physical and mental well-beings as well. So just to conclude this most major finding, that mostly the student perceive the online learning positively. And this regarding how flexible is it, this regarding how available is it, and the saving time as a trainees. And they also, most of the studies show that they like the initiatives of the medical teachers or the teachers themselves in developing innovative way of teachings, and they accepting the online courses. However, is it really preferred tool of learning? This has different or variability of perceptions. They believe that it's acceptable, it's preferred, but mostly for students in the pre-clinical years. But students who actually facing a big challenge regarding their clerkship training and clinical training, they prefer the face-to-face learning. And most of the study also report the challenges that faced on online learning. That include the clinical training, the major things that has a challenge is the clinical training, the clinical skill, how the students are supposed to develop these within the blended learning format. And the student assessment. This is one of the big challenges that regarding different approach of assessment, different modality of assessment, regulations of assessment. And another thing that the passive online activities, sometimes they blame the instructors or the teachers when they produce not interactive learning session, and their communication with the teachers and instructor become really negative. And the most important things regarding this is developing new learning behaviors. Students supposed in the present of online learning they're supposed to develop and lead their own learning, because they're supposed to sit at home with their laptops, for example, and encourage, motivate themselves to continue the lecturing. Okay, so they have a different learning behaviors, and most of the study report that the student has major decrease in the time they spend in their learning activities. One another things that most of the study measure the student in anxiety, stress, the level of stress, and the burnout. And most of the study indicate that there is an increase in the number or the percentage of stress, burnout, and anxiety among students. And a simple study has been done in Al-Qura University measuring the student perceptions of the blended learning format last year, and the level of burnout they have. And we found there is a kind of association between the level of burnout and student unsatisfaction with the blended learning format. A study also said that there's a big challenge regarding to the student professional identity. After the COVID-19, the online trainings, a lot of things has been changed and challenging the student professional identity. How they're supposed to be a future physician? Are they competent? How they will serve this kind of community and these big challenges, and could be a future challenge. Many studies actually have outlining the new norm of medical educations in different specialties, and try to overcome and just have to the roadmap how we as a medical school, as a medical community will move forward. And that just gets us to the McKinsey and Company outline or framework of how suppose the missions from the current situation of COVID-19 and in 5 phases that include the 5 R's. Resolve the problem, resilient, return, reimagination, and then reform. Regarding this, we find ourselves as a medical school going through this transitions phase. At the beginning in March 2020, yes, there's a big problem that we have to resolve. This clinical training has been suspended, distance, the physical distance has been indicated, and everything has been turned online. Then we try to resilience, how can we change, how we can complete the year. So most of the medical school postponed the final year exams. So the internship has been also postponed sometimes. Some decision that shall we graduate the student without OSCE, shall we make a virtual OSCE, is that really called an OSCE? So a big challenge has been, but we find our way through. And then again, when the last academic year in the September 2020, we have to return, okay, with still no face-to-face teaching or limited face-to-face teaching, and there's a bigger challenge. From there, we try to reimagine what is the future directions of medical education, how we will move forward, and we try to do this and to have the reform. Within this journey, different medical schools have different guidelines, especially with the Ministry of Education's movement to have almost 3 semesters. So there is a lot of effort to reform the teaching, the curriculum, and the assessment process. From this perspective, we would love to have a student insight coupled to these future directions. So We conduct a simple study, try to measure or explore the further attitude and perception of students of e-learning, and their opinion about what is the directions of medical education in the future. So it's a focus group study has been conducted, the study population were mostly from the Western regions, and they were an intern. So in general, 25 medical students contribute to 4 focus group, and each focus group was concluded for about 60 to 75 minutes. The interview has been recorded, transcribed, and then the data has been reviewed, analyzed regarding to the Crosswell coding process framework. The major participants were 25, okay, and most of them were female, and representing 5 medical schools and almost private and governmental medical school as well. 4 overreaching themes has been reached is regarding to the COVID-19 as a paradigm shift of medical education. So how the interns believe that the future directions of medical education will be. So they believe that there's a kind of COVID-19 make a paradigm shift in medical education. They believe that the medical education will be digitalized. They believe that the curriculum content and teachings approaches will be changed. And they expected all of these to be concluded a lot of challenges. What are these views? How the paradigm shift of medical education. They believe that medical education within the COVID-19 make a bigger challenge for medical students, and that's challenging their own training. However, it changed the practice in medical school regarding teaching, assessment, and learning for the student. They believe that it has accelerated the transformational of teaching and assessment approaches in a positive way. They visual that learning include interactive online learning platforms were really innovative approach of teaching and supposed to be continued. And they believe that the pandemic imposed change in the student, in the teachers, and in the schools themselves or itself. And it also has imposed a change in the learning process. So this is some of the student quotation. They believe that the pandemic had negative impact on, the pandemic has a negative impact on my clinical training, especially the last year. Yet, I can't deny the advantage of virtual simulations and virtual patient. Or another student said nobody could imagine that medicine could be taught the way it is today. These challenge teacher and student. Or I believe that the pandemic forced teachers to innovate their teaching with the educational technology. A lot of things that has really, they understand the bigger challenge that they are facing, but they believe that these challenges are positive somehow. Digitalizing of medical education, and this is actually concurred with different literature emphasizing the same thing, that the pandemic digitalized medical education and shaped the mode of delivery. The necessity of e-learning. Medical education, or in turn, believe that e-learning become a necessity of today's student. And we have to meet the student expectations and skill. And computer-assisted learning, different modality in medical education, it's really changed the way the medical education regarding is taught in basic science lectures or clinical training. And that has been reflected also on the trainees' preparedness. Are they ready? Yes, the interns believe that they occupied the skill to be new generations of learners. So the pandemic, they changed them and the teacher skill, knowledge, and attitude toward e-learning. And they're mentioning that there is a lot of investment in different universities in the technology educational platforms. The most important things here that mentioned by the student that the school regulations and infrastructure supposed to accommodate this change and the digitalizations of the program. And these are some of their quotations. Some disciplines require blended learning sessions, such as radiology, other required face-to-face interactions. Novice and general students have a specific expectation and need. Regarding online learning, I also have a specific expectation from this internship program. So different views that, yes, we are a digital generations, we need to have these applied in our own learning. And it did, and we would love to have it to be continue in the same way. The third aspect is regarding the change in the curriculum from the content and from the delivery itself. So many of the student quotation was mentioning that there is a big change in the clinical practice, and that's supposed to be reflected in the curriculum itself. Medical curriculum. For example, the telemedicine and the virtual clinics. For example, the emphasis of interprofessional education, because the practice actually, after the COVID-19, become integrated practice, medical practice. And the caring for others, social accountability has been mentioned in the morning, and emphasize on patient safety and proactive healthcare leadership, because they believe that they are not needing just a physician, they are needing physician who can lead and be proactive for the crisis if any future of crisis happen. Also, medical curriculum should allow flexibility in the training and assessment. And they saw this as we just try to overcome the challenges of COVID-19, and they would love to continue this. So blended learning or some distance learning courses is suggested by the interns. Develop clinical placement learning opportunity to reflecting the patient safety. It has been also asked. Emphasize of student lifelong learning. Okay, and structured feedback has been emphasized by many students. And these are some of their quotations. I believe that the clinical training should focus on patient safety. The previous approach of bedside teaching in a large group is not appropriate anymore. And so they try to understand that there is a need to just utilize the advantage of COVID-19 and try to implement it in the medical programs. Also, they report that regarding their vision of digitalizing of medical education, how it's supposed to happen a paradigm shift in medical education, and about the change in curriculum regarding to the content and mode of delivery, they expressed some challenge in that pathway. For example, the readiness and motivation of student and instructor, it will be challenged if the teachers and the students are not motivated and not really occupied with the right skill. That will just make it a really difficult situations, and we don't get the advantage of the e-learning or blended learning approaches. Reduce the early, they're afraid that with introducing of technology or with what's happening after that, we will reduce the clinical placement, or at least not have it an early clinical exposure. Another challenge that reported on the literature also, and has been mentioned by a student again, is the challenge that related to technology or the skill that required. Finally, the student mentioned that the trainees' wellness, mental, physical wellness, it has supposed to be focused. They're reflecting on the challenge that faced within the COVID-19. It has a lot of challenge, so changing the educational environment, changing the educational strategy, policy, or the mode of delivery is actually causing kind of stress for a student. And they would love to have a really proactive system to help the student continue and support it in different challenges could be expected happen in the future. I enjoy online case discussions and clinical seminar, yet the only success factor of the session is the motivation of instructor and his passion. Or as the student said that I had a serious stress and anxiety at the beginning of the pandemic. I was afraid that I losing my clinical competency and be a lousy doctor, yet my mentor provides support and counseling. Today, I'm proud of being a competent intern. So this kind of reflection on interns regarding to their experience is really valuable. Just to highlight that the vision of the future director of medical education, there's supposed to be a paradigm shift. So as a dean, please make this happen. We need to take the advantage of COVID-19 and make another change in the medical education, in the way of it has been delivered, in the way it has a different content. As we mentioned, that community-oriented practice, health advocacy, emphasizing patient community well-being is really essential in today's medical education and supposed to be reflected on the curriculum. Social accountability, as been mentioned by Dr. Al-Hassan, is really important aspect of all medical programs. But just question ourselves how we implement this. One of the students here mentioned in one of the quotations, but I missed it, that it was devastating that the medical school doesn't support medical students to have initiative helping the community at the time of COVID-19. So they want to have a structured program to lead, to be a future leader, and at the time of being a student, to be a student leader. To discuss all of this, the COVID-19 pandemic has had a major change on the healthcare system, and that reflects on the medical educations, and it transfers a lot of our own practice. Participated interns had experience of online learning for 3 semesters, and they have also the experience as an intern for 4 months. And this makes the reflection on the experience of online case more valuable and more realistic. However, the intern expressed their dissatisfaction actually of the impact of the pandemic on their education. They expressed how these changes helped them to be the way they are today, and they reflect about the experience from different perspectives, negative and positive point. The suggested future directions for medical education, as been mentioned by the study and the candidate as intern, were very promising and actually positive to see those young generation having these positive beliefs. It also concurs with different literature that has been published regarding to the what after COVID-19. Trainees' insight maybe help medical educators to shape the future of medical education and clinical training to suit trainees' expectation, because we have to understand students that we have today and tomorrow are not the students that we had in January 2020. They are different, they are more mature regarding to their skill in technology, they are regarding their expectations, and regarding how they are a directed learner. Actually, this is a simple study that we just try to conclude to reflect on the student perceptions and views of what is the direction of medical education, and it's supposed to be coupled with more quantitative study to validate the student these results and on a bigger community and population. Okay, the take-home message. Online learning is essential aspect of today's education. Undergrad, postgrad, it's essential aspect and supposed to be considered by different medical schools. The pandemic accelerated transformations of medical education and clinical practice, and there is a lot of value that we are gaining by doing this. I remember when I was a Vice Dean of e-learning in Al University, I really faced a lot of challenge regarding convincing the staff member to utilize the Blackboard. At that time we were using the Desire to Learn platform. And when they use it just like a Dropbox. We try to involve them to having different initiatives to have interactive platforms, interactive forums, interactive learning experience, flipping classrooms. It was really difficult. But today, these are the language of the instructor in the higher education, and these are the language of a student in the meantime. The new normal of medical education dictated the shape of undergraduate and postgraduate medical education, and that reflecting on an undergrad and residency program as well. And it's a moving train. Students are just on the train, so please don't miss the train, because we really need to have that leader's physician in the future, and that starts from today meeting. Thank you.
Thank you very much, Dr. Rania, for this excellent talk, and we will open the floor for discussion or